Health Disparities Research Center and our new funding opportunities. So this workshop, our first workshop, we provided a lot of information on NIH grants and the expectations for that. And so this workshop, we wanted to focus in a little bit more on our new funding opportunities, as well as our expectations, applications, and the timelines. So that's sort of the goal for today. I'll be leading the conversation along with Dr. David Lowe. So I don't know, David, if you want to say hello.
Hello.
Welcome again. Let's see. Okay, so just a little background on the center. The Center for Health Disparities is a new center that's funded by the National Institutes of Health, and specifically the National Institute for Minority Health and Health Disparities. We just received our award in August, and in some ways that feels like so long ago, and in other ways it feels just like yesterday. So particularly in this moment, the COVID moment. So, but we are still really enthusiastic, and as you can tell, we're moving forward on the projects and providing that are interested in health disparities research. So the award that we received is called a U54. So it's Centers for Minority Institutions, and it's $16 million over 5 years. And again, it is one of the largest awards that UCR has received from the National Institutes of Health. And we are also part of large CMI network of institutions. So there are centers of this kind from Florida, Texas, New York, across the United States. And we meet at least annually to share research. So for people who are interested, that this is an opportunity, the RCMI conferences are opportunities to share your research with larger groups of people who are doing this work. The Center for Health Disparities Research is really focused on creating and building the capacity of our campus to do health disparities research and to do research that is community engaged. So the questions and the involvement with our community starts at the ground level and works all the way up. And so many of our efforts are really focused on providing training, providing tools, providing the support and the connections that we need to be able to do health disparities research that makes a difference for the communities, particularly in inland Southern California, but then sometimes reaching out more broadly as it connects with inland Southern California. We have when we think about the center, we really think about it as an interdisciplinary group. So you see our co-PIs are from different colleges across campus. So the School of Medicine, CHAS, School of Public Policy. And, you know, we're really working to bring more people into that process. And so with our PIs and our co-PIs, we have 5 different administrative cores, or cores that work together collaboratively to support the work that we want to do. So we have the administrative core that is co-led by David is the director, and I'm the co-director. We have an investigator development core, which people who are already funded, or some of you may have been to our first couple BFFs, big, feasible, and fundable training sessions, where we gather together and build a support group. We're working on building a support group so that our capacity to do interdisciplinary health disparities work is enhanced, and we have the training and skills that we need to successfully apply for NIH funding. So the Investigator Development Core is co-led by Monica Carson in School of Medicine and Bruce Link in sociology, and public policy. Then we have the we have the research infrastructure core. That's led by Cecilia Aon in School of Public Policy. And the focus of the research infrastructure core is to provide training as well as other resources and support, individualized support for your research grants. So we'll talk a little bit about it later, but they'll be creating a IRB navigator, as well as statistical consulting, ethics training, and some community-based research training. And that is in combination with our community engagement and dissemination core. And in that core, we really provide support for training in how to do community engaged research, but also to provide an avenue for disseminating the kinds of research that we are doing as a center. And then the final core is our recruitment core, recruitment and retention core. Part of what the goal of the center is to bring in their ability to successfully obtain NIH funding. So as I mentioned, our center grant is funded by the National Institute for Minority Health and Health Disparities. And they've been working really creatively recently to strengthen their outreach and improve the methods and skills that our researchers have and need to have in order to create more projects, more research programs that make a difference, that move us toward health equity and reduce so many of the disparities that we see happening across the United States. And so one of the ways that they've been doing this is to build their research framework. So a lot of times when you look at NIMHD proposals, there are different levels of influence that they're thinking about, so individual, interpersonal, community, and societal, but also the domains, so biological, behavioral, physical, built environment, environmental, culture, and health systems. And all of those are aimed at sort of shifting health equity. And for those of you who are in public health or in the conversation around health disparities, you'll recognize that much of this is framed around social determinants of health. So this is the framework that they're kind of thinking about, and really being able to put together, for instance, interpersonal, so household and environment, with the physical built environment, and thinking about the intersections, the relationships that create disparities and end up with worse health outcomes. So because our center is funded by NIMHD, of course, the funding opportunities that we offer are based on their goals as well. So we have a few ongoing funding opportunities, and you can find out more information about them at our website. That is listed here. So those are our interdisciplinary research working groups. Sometimes you'll hear us talk about them or refer to them as earwigs, because the IRWG kind of sounds like earwigs, and it was a funny way to easily say. But everyone ends up asking, what does earwig stand for? So anyway, these are interdisciplinary research working groups. And part of the goal of those working groups is to set the foundation for the emphasis on interdisciplinarity, and set the foundation for people to gather together and prepare proposals. So figuring out where your research agendas align, figuring out where your methods and your analysis efforts align, and then how do you create that synergy? How do you make that synergy so that you can successfully apply for more funding? And the goal for this, the interdisciplinary research groups, can lead to some of the other funding opportunities, but one of the primary goals is to then have people, those groups, apply for the pilot interdisciplinary collaborative grants, so the PIC awards. So those two are supposed to flow naturally together. We also have our continuity collaboratory fellowships. We're primarily focused on graduate and postdoctoral fellows. So for existing projects. So a PI of an existing project who may see their funding starting to end, but they want to keep the relationships with the community and the graduate students on going, that they would apply for this funding so that those students would receive support, the relationships can be maintained until the next funding opportunity. And then the fostering interdisciplinary research early stage opportunity. This is to support training and pilot research for emerging investigators. And I do want to make a note, because sometimes we get asked, is this only for postdocs or assistant level professors? And, you know, of course, those are people that we want to support, but it really is for people who are new to the NIH funding kinds of cycles. And so this would be their first award that allows them to get the pilot data that they can then move on. So it's not only for assistant level faculty. So those are our ongoing opportunities. And then now we have two additional funding opportunities. The first one is around COVID and health disparities. So here we're looking for projects that are really addressing so many of the disparities that we're hearing about and seeing with the coronavirus. We know that Black communities are experiencing higher rates. And Latino communities are experiencing higher rates, you know, and thinking about how do these intersect with labor, how do these intersect with community resources, how do these intersect with some basic science questions as well, right? How do they intersect with policy? So there's a lot of ways that you can approach this, but the focus has to be on some of the disparities that we're seeing around coronavirus. And then the second funding opportunity is around clinical research projects. So we'd like to see more research that is based in clinics with our physicians and creating new and novel ways to address what's happening there. David, did you want to add a little bit more about the clinical research projects?
Well, certainly, especially in our School of Medicine, where there's a lot of emphasis on primary care, our physicians encounter health disparities every day, and I think this is an opportunity to pursue clinical research projects to begin to look at some of these questions.
So in terms of the funding opportunities that we have, all of them do require a community engagement statement. And then if you're awarded, all awardees are expected to participate in HDR at UCR workshops and conferences. So this would include the big monthly big feasible and fundable meetings. Right now they're happening the second Wednesday of every month. And also we have an annual symposium where our awardees present their work. And then along the way, there are additional events and training opportunities that are optional, but the two that are really expected is that you are participating in the BFF meetings and our annual symposium. And in this regard, really, as we're building the center, these are the kinds of things that we need to be doing to build a lively and successful center with our scholars. So the funding applications, the timeline on the funding applications that are coming up, our next application deadline for the 4 regular ongoing funding opportunities and the 2 new funding opportunities, that deadline is June 5th. There's no set number of awards, but it will depend on the quality and availability of funds. This first round that we had, we funded 2 FIRST projects and 3 PIC projects, as well as 5 earwigs. So are reviewed by our internal steering committee, which are the PIs and co-PIs of the grant, as well as our co-leads and the 2 research projects that are under the center right now, which we'll talk a little bit more as examples of things that can be done. So that's the reviewing committee. And then if you are successful in this round 1, you'll receive an intention to fund notice. And then once you receive that notice, there will be some documentation that you'll need to turn in to us. So any IRB approvals, conflict of interest, and any other approvals that you would need for your research. After we have those materials, which we hope it'll only take us a couple weeks to get those together, the files are approved by UCR, and then we send them to NIH for final approval. So our goal is to have those submitted to NIH by July 15th, and then NIH has their decision. You know, it's been taking about a month and a half. So we anticipate that you would be able to have a begin date of September 1. And then just one more thing, we will have another funding opportunity that will be released in June, and this will be for graduate students. So graduate student fellowships that could support some of their dissertation, as well as provide a stipend for them while they're doing their work. I'll stop here real quick to see if there are any questions before we move on about the timeline and what the opportunities are. No questions?
We don't have questions yet, but just as a reminder, if you want to write any questions, you can do it through the chat or just unmute yourself. You can speak up.
Hi, Juliet. It's Mira.
Yeah, hi, Mira.
Hi. I had a question, 2 questions. One is the previously funded grants. Is there a description or summary of what these topics were about? And did I miss that?
Yeah, so our previously funded grants are on our website under the funding. So there's a whole section, 2019 grant awards.
Okay, thank you. I'll look that up. And then my second question is, you know, in terms of these interdisciplinary research groups, I'm a biomed researcher, and I would be really excited to be able to collaborate with someone who knows more about community engagement and how to make a survey, because we're thinking of doing some coronavirus research. How would you advise me to partner up or find people who might be interested in collaborating with me on this?
Mm-hmm. Well, there's a couple ways. One, you could start with a earwig award and, you know, gather a few people together and have an open conversation. And then also we could help you, you know, figuring out who's out there. That's part of our role, is to be connecting our scholars across campus. So, you know, just knowing that this is something that you would want to do, then we can start reaching out to our networks as well. and connecting you with people. So that would be great. You know, that is exactly the kind of work that we're hoping to be able to support and foster.
So, you know, along that lines, maybe right now I might not be eligible for an earwig award because I haven't thought about it enough, but would you have a Google conversation or sort of link where people could say, look, I'm interested in that. Could anyone, you know, anyone else interested? Because I know everyone is so busy with other projects that they might not have the bandwidth to help me with mine or the interest.
Right. Right now, I would send it to me, David, and Catherine. And we don't have a Google link yet, but I really like that idea.
Or a forum or something.
Yeah.
I know there's things like Slack, like, hey, I'm thinking, I mean, just out to my group, my interest is, for example, trying to understand the long-term effects of coronavirus infection. And if I manage to recruit the patients and the follow-up studies, it would be a perfect avenue to be able to try and understand whether there's some, you know, demographics or some like high-risk factors that I wouldn't have thought about because I have no idea how to write a survey.
Right, right. Oh, David just said, we have our listserv, so we could also send out the call through the listserv, where we have scholars who have attended all of our events, people that have just contacted us, as well as some community members who may also have interesting connections. Yeah, so right now I would say send what you are interested in right now, and then we can both individually as well as create a conversation where you could connect with you who would be interested in collaborating with you. Actually, there are a few people in this webinar or this workshop right now that I could imagine might be interested in collaborating with you. So we can definitely make the connections.
Thank you.
So maybe I can put a few cents in here. It's like community engagement can be at many different points in the research project. So you can use community engagement to have the stakeholders give you input on what are the key issues that need to be addressed in the research. You can work with the community members to help with things like recruitment of subjects or provide various kinds of information on where to get the data, things like that. And then at the end, also the community can be an important partner in disseminating the results of your study. So there are a lot, so that you can be really broad-minded about ways in which the community can participate in the research project. So
that's really useful. Thanks, David. I didn't think about that.
Any other questions before we move on?
I had a question.
Okay.
Hi, this is Sunny. I'm in chemical and environmental engineering. I had two questions. One is, has the HDR Center thought about how deliverable deadlines are going to be impacted by the inaccessibility to human subjects research locations and things like that? So is that going to affect this funding at all?
Right. We have been flexible with the funding, as has NIH. So, sending, if you are already someone who is funded, or if you were funded in this round, if there is a concern about the timing, then you would ask us for an exception. But there, we are attentive to that, and I think there's a bit of flexibility. I don't know, David, did you want to add a little bit to that?
I think, did Dario have a seminar or webinar, something like that, discussing this kind of issues, like how do you do human subjects research, community contacts, because of this whole aspect of social distancing as well. And I think it's going to be a combination of when the local government and state government opens up. That's one aspect, and it depends on when you really want to get started. And what are the best practices in terms of like not getting you or participants infected. But in terms of timing too, keep in mind that generally a lot of these funds are available to spend over a period of up to 18 months. And so hopefully as a lot of these kind of like best practices are worked out for these kind of community-based studies, I think there will be a chance to, there'll be some time to kind of work through some of these technical, practical issues. And then of course, I think one of the things that our center should be responsible for is disseminating that kind of information and helping people figure out how to solve these issues.
Oh, thank you both. That's super helpful. My second question is, does anyone in School of Medicine have special access to any of the coronavirus infection rates, hospitalization rates? What if, because I could very quickly put together some kind of meta-analysis overlaid with air pollution data, things like that. Do we have any data to support studies of that nature?
We've been discussing some of the clinical studies in the nearby hospitals that have COVID units. In terms of general statistics, I don't have that, but the County Department of Public Health probably does keep some of those statistics. And I think that's something where we should try to set up direct communication to get access to that kind of information. But I don't have that right now.
And I would also add that Riverside Public Health, as well as San Bernardino, although the way they display their data is a little strange, but they have both been pretty open with the data that they do have. So on their websites, you can look and see what kind of data is already there. And then King Fang just mentioned that Esri may have some data as well. So
yeah, my husband actually works for Esri and is working remotely right now. And so they have all the raw data there that's available to everyone if Sunny wanted to use that to do her analysis.
Yeah, I just add one thing in. You can log on to, every UCR people has access to ArcGIS. You can log on to there. They have a business analyst or they call it some hub. It's COVID-19 data. You can go there and download things from there.
oh, great. That's great.
I did want to say that IRB seminar was really informative, and as someone said, was recorded. But what was really useful, because I'm writing an IRB right now, is to think about different ways of getting consent that's either online or trying to find a way of like documented recorded consent rather than all the paper and the distribution of paper, but that might not be logistically possible anymore, especially since if you want to work with the clinic, they're overloaded right now and very worried about, treatments and things like that. So the added thing of consent might take time.
Yeah, it might be useful if some of us come up with boilerplates for that, because I'm working on the same exact thing, what do we do when, the paperwork doesn't quite fit the moment. So, yeah. Okay, I'll go ahead and move on, and then we can have more discussion too at the end. This was great. So the things to keep in mind are the goals of the proposals need to look at disparity, but also have a community engagement component. What we found in the first round is that a lot of the proposals had good description of some kind of difference or basic science, but they weren't really addressing a health disparity. So really thinking about, you know, what is a health disparity? Things that are closely linked to economic, social, or environmental disadvantage. And weaving those in, thinking about the ways that the kinds of mechanisms, how are economics, how is social relationships, which can mean racism, historical injustices, as well as the environment. How are those mechanisms that create disparities, or maybe things that can help solve the disparities? So really being attentive to what is a health disparity. This is one of my favorite slides, and I know it's from the Bay Area Regional Health Inequities Group, but I think they pulled everything together so well, thinking about upstream effects as well as downstream effects. And currently, often our disparities research just focuses on risk behavior, smoking, poor nutrition, or communicable diseases, and how that leads to mortality. So it's very individually focused. What we want to do is really shift the conversation and think about the upstream components. So, you know, social inequities, institutional inequities, what's happening in our schools with our laws, and then also living conditions. So you can think about our project one that David Lowe is leading on childhood asthma in the Salton Sea. So what's happening in the exposures to toxins in the living conditions, and who's living in certain areas that end up creating disparities in the rates of asthma or the outcomes among children with asthma. We could also think about this in terms of the second project, which is on childhood obesity with Latino families in the Coachella Valley. And, you know, what's going on in our schools and in the educational system that actually shifts the way that infants are being fed and leads to poorer health outcomes. Right, so these areas that they're highlighting in the upstream, the living conditions, the institutional inequities, these are also the same areas where you can increase your community engagement and where you can increase engagement with policy that ultimately changes the health inequities. So really thinking about what is going on in these upstream areas as part of your projects. And these also lend themselves to interdisciplinary collaborations, right? We need our scientists, we need to understand what's going on with the bodies, with exposures, with toxins, to link up with what's going on in our institutions and in our families and in society broadly. Right, so that those all take interdisciplinary teams. So as you're thinking about the social determinants of health, you're thinking about health disparities as part of your project and community engagement. You know, think about not just these downstream effects, but the upstream effects of what's going on. Did I freeze? Yeah, I was asked, David, did you want to share this example?
Oh, okay.
Sorry.
Yeah, so of course, a lot of the issues that we see that have health disparities, there are many different areas where we are aware of disparities in terms of outcomes, access, things like that. For example, cardiovascular disease may disproportionately affect certain under-resourced or underrepresented minority groups, whether cancer or stroke, things like that. And so what we want to emphasize here is that the focus is not so much on, I mean, yes, a disease may have differential impact on different groups. But doing studies to simply come up with the numbers for how different those impacts are is not actually research on the health disparity itself. It's just defining the differences in outcomes. And so we could come up with an example here. So for example, and I'm not picking on parasitologists, Mira, but if you consider that you could have a disproportionate incidence of congenital toxoplasmosis in low socioeconomic status families. If we simply look at the disease mechanism, we may not be actually addressing the underlying mechanism or cause behind the reason why there are disparities, why certain groups are affected versus others. So if instead the issue is how are lower socioeconomic status mothers differentially affected in terms of access to care or cultural practices, or, you know, I mean, you can come up with a lot of social determinants, whether it's stigma, whether it's food and nutrition practices. All of those things really address not the disease itself as much as they address the factors in society and practice and so on that may actually feed the actual disparity itself. And so if a health disparity is suspected, the idea is not to just say, well, yes, indeed, there is disparity. The question is, from a research point of view, how do you create a research hypothesis saying, I think the reason there is a disparity is because of this underlying mechanism or this underlying cause. And so from a research point of view, the research project tests that hypothesis and gathers data to look at that kind of question. If it turns out that, for example, there's a genetic basis for why there's different outcomes, that can also be a mechanistic basis for a health disparity. It can be situations where there's overlap between mechanism of a disease and a health disparity. But as I said, there's a large number of ways you can go to actually look at mechanisms that are contributors to the outcomes in terms of health disparities. So anyway, I thought that would be a way to help you think about it.
Yeah, thank you. And so then the other piece, so that's the health disparities piece, and really thinking around what are those questions that are disparity questions and not just difference questions. The other piece, as we said, that is required for proposals is the community engaged research component. And as David mentioned before, there's all sorts of levels of community engagement. Sometimes people get concerned because they're like, I don't do that. I don't spend tons of time in the community, but there are so many levels to do this. And part of what needs to be acknowledged is the reason we have community engaged research. One is that who better to know what's going on in their lives and what's relevant to what they need. So, you know, involving people in even the questions, developing the questions that we ask about health disparities is critical. The other piece is research fatigue. So often community members are asked to participate in research, but they never see what happens afterwards. It's like, oh, I answered this survey, and they have no idea what happened to it. So our responsibility in building trust, but also building knowledge in our communities and capacity to make the kinds of changes, policy changes that improve health equity, that move us towards health equity. You know, having them in the conversation and sharing what we learn in our research with the people who actually helped us create it is critical to the larger goal of the center. So, you know, this slide is really nice because it gives you a sense of the more intensive where community members or community organizations are collaborators in defining the questions, designing the methods, actually helping you collect the data, analyze findings and disseminating the results. But then there's, you know, lower levels where you're starting to build relationships, where maybe a community organization just wants to help recruit people into the study. So, you know, there's that piece. But the dissemination piece, I think, is one of the easier things to do, really, is to share what we find. And the community engagement core is there to help you disseminate that, to help you figure out how to do these things. So there's just a variety of ways that you can incorporate community engagement. So if you're not sure, make sure that you reach out to myself or Jennifer Syvertson, my co-lead on the Community Engagement Core, or Catherine, our project manager, who will make sure we all get connected, right? So this leads into some of the resources offered by the center. So our research infrastructure core, we have a IRB navigation. So if you're not sure, you know, how to talk about community engagement in your IRB, or how to talk about disparities in your IRB, let us know. We have a team of people who will review and go over the protocol with you and provide suggestions, also provide maybe some boilerplate conversations. We also have, with the research infrastructure core, statistical consultation. So right now it's biostats. We're working towards getting social science stats consultation as well, but we absolutely have biostat consultation available. And then the community engagement and dissemination core has our community engagement studio. So if you're working on a project, you can bring that question to us and we review it, and then bring together a group of community members who you'll present your idea, your project to, and then they will provide feedback on, you know, what are the best ways to engage community given your project. So the studios are a big part of what we'll do. All of these resources are on our webpage now under the community, or the center organization and resources tab. So you can just click on those and send your question, and we will start moving forward on finding the collaborators. Thank you, Catherine. She just put the link in the chat. So application expectations, you know, again, we have the two pieces, that it's disparity and that there's a community engagement. And then all of this information is on our website. The Interdisciplinary Research Working Group, so the earwigs. This is a shorter application, 1,500 words. You have to have at least 3 different disciplines in the collaborative and different career levels, and then just really focusing on what the problem is for the health disparities, and that's $2,500 to bring people together. So list of organizers and participants and your CV. And this is an area where we want to get people starting to think about how to fill out their NIH bio sketch. Whereas the other applications require an NIH bio sketch, but it's an opportunity to start thinking about how to do that with that interdisciplinary group. Then the applications for our first pick, the clinical and the COVID focus, all have the same requirements, and these are all based on NIH guidelines. So basically you'd want to take your approach sections A through E, you know, and copy those sections into your Word document and then fill out the information. So the cover page would have your abstract, and then who you are, your applicant, and contact information. If you have a mentor, if you're applying for a first, put the mentor in there. A brief summary of the background of the project and your hypothesis to be tested. And then, as I said, these categories A through E follow the NIH background. One of the bigger changes is that we've added the community engagement plan as part of what you need to address. And as I said, we did a more in-depth review on these proposal writings in our first workshop, and that's available on our website as well. But if you have questions, let us know. So these are the additional information references cited. Everyone needs to have a budget, and there is a budget form to fill out on the website. These ones do require the NIH BioSketch format and drafts of human subjects protocols, and that you've already taken the city training. The other difference for first awards is that you would be required to have a statement on mentor fit, as well as a letter of support from your proposed mentor. The continuity collaboratory fellowships follow the same guidelines as the other forms in terms of having the background and significance, relevance to health disparities. This one, the change is in that you need to have a continuity activities plan. So we'll need to have a sense of what the project is and how the graduate student or postdoc is helping to bridge from one project to the next.
Dr. McMullin, the 6 pages are double or single spaced?
Single spaced. Yeah. So basic NIH, so 12 font times Roman, 1 inch margins, single spaced. So the format is pretty standard, but you get to play a little bit more. And then some of we thought we'd have a brief conversation on the NIH BioSketches. And so David, did you want to?
Yeah, so keep in mind that the center funding from the NIH is designed to build capacity and basically help train, especially investigators with less experience in NIH funding and less experience in health disparities research, to actually learn the NIH format, the NIH application system, and to really raise a whole group, a cohort of people who have who can use their existing strengths to write more competitive NIH grants. And so this section is actually covering some of those things. So, for example, in the biographical sketch, there's a standard format that the NIH uses. It's rather different from the NSF BioSketch, for example, where some of the things that are really emphasized here are contributions to science, a statement describing the kind of research you do, existing and past funding, things like that. And there really isn't as much of a section where you talk about who your collaborators or your teaching and things like that, because it's really about you and your qualifications to do the research, and that's the emphasis there. Anybody who is going to be applying for this, ideally you would then also sign up to get an ERA Commons username in order to get the NIH to review and approve your subaward. If we give you notice to intend to fund, you will have to have a Commons account. And all that means is that you have a name and identity on the NIH system, so that you exist as a real person. And some of the things here, as I said, the customized personal statement that speaks to your background and experience, and your research direction that again talks about your qualifications to do the research, and all the other sections follow along the same lines, really telling you, telling the reviewer why you are the best person to do this particular type of research. Next, yeah, let's see. Yeah, so I mean, we don't have to go into a lot of detail, but there's contributions to science section again that really goes to what your background is, publications that are relevant to the kind of background and things like that. Research support, again, if you don't have a lot of NIH experience, it's not as critical here, but again, it does go to what kind of track record you have, kind of defining the kind of background and experience you have. Then next. Okay. Now, again, back to the idea that we're talking about NIH, focusing on NIH formatted grants. Because we do have to submit the pilot grants and so on to the NIH for the program review, that means that all the other aspects as well, not just the biosketch and so on, have to conform to NIH standards. But the NIH also has specific rules on what types of things that you're allowed to spend their money on, all right? And so we also include a budget template, and the budget template has a couple of key sections. And so this template is something that has to be included in the proposals when we send them to NIH for review. So they will include things like the personnel list in terms of who they are, how much commitment that you're dedicating to this particular program. And then it covers sections to describe each of the specific costs. There may be research supplies, there may be consultant costs, there may be travel costs, payments to subjects and things like that. And they're detailed, you can see in each of these various sections on the NIH budget template. So as long as you're able to justify each of those expenses and fit it onto this template, they can be reviewed and approved by the NIH. I don't want to go into a huge detail, but there are certain types of things that make it a little bit more complicated. And those are things I'm happy to answer. For example, do you intend to buy equipment? Do you intend to hire graduate students? Do you intend to hire somebody or develop a subcontract to another institution or a collaborator? Those are all things that have impact on the way the budget is set up. And you can, if you have any of those kinds of things that you intend to include, definitely you can contact us and we can discuss that and help make that all work out. Anything else there? Okay, go ahead.
So just to close, as in any kind of writing and grant writing, start early, revise a lot. We're here. People often contact David or myself to look at the proposals beforehand. So, do keep in contact if you have questions. We're happy to answer them. And also, again, don't be discouraged if you're not funded the first time or the second time. I love this. Persistence is a winning strategy. I always say that our middle name is rejection. All scholars, our middle name is rejection, and persistence is our second middle name. So also make sure that you're looking at the literature and, talking to other scholars. The interdisciplinary aspect of this is really exciting and a way to move forward. So it's great to hear that people are on board and wanting to do this, and we just need to get the connections going. So we're here to help create those and create the space so that those can happen. And so here are contact if you have any questions, so David's and my email, Christina Gonzalez. I should have added Catherine on here as well, Rodriguez, although you probably have her email from this event. And then we'll have a FOO soon that you might also contact. Catherine, I have to say, has been doing an amazing job on our Instagram and Twitter. So if you have any questions about resources that are available for our community members right now, she's been putting out a lot of information through Instagram. And I think that's it. Any questions? Any additional questions?
I have a question.
Yeah.
Okay, first, thank you. Thank you, Juliet and David, for this great opportunity. My question, maybe I should contact you individually, but I just say it generally. When we talk about the social determinants of this health disparity, we may be looking at the factors that are leading to the results. We're looking at the factors resulting to the disparities. I'm wondering for this COVID-19 as a public health crisis, our research looking at how the impacts, I mean, we know different communities, they are hit differently. The preliminary data already talked about that. But obviously, how different communities are coping with this public health crisis, socially or economically, are this type of research, I mean, do they belong to this? Belong to the, I don't know. Because when I look at your instruction on example 1, it just talk about the social, economic, this and that. But this is different from like when we talk about the factors leading to the outcome, but we're talking about how we handle them, how we cope with them. So the social vulnerability and the different impacts from this public health, from this pandemic, and they all connected with the community resilience, obviously. But how, I know this is truly interdisciplinary, but not only health per se. It is something, it's how to cope with them. So my question is just whether this type of research fits into your center's agenda.
Yeah. So following the from NIH, there are a number of projects that are questioning resilience and how communities are managing 19 and disparities that are homes as labor and mental health. And so I guess I would say that, yeah, those do fit. We would want to connect it back to some kind of health outcome, though, is what, I'm seeing from NIH. So those are questions that are being asked at the NIH level, but they are always connecting back to some kind of health outcome. And often it's mental health outcomes when you're talking about resilience. But there are other health outcomes that we could attend to that are part of what you described.
I think,
and I think, yeah, and I think that to go along with what I was saying earlier is that seeing differential impacts in the communities, especially in terms of resilience and say mental health consequences, I think it's an appropriate start. And then the question is, again, back to what is the hypothesis? What is the mechanism? How is it that the impact of COVID infection leads to that differential impact? And so simply saying, yes, there's going to be an impact is a starting point, but then the next step is what are the factors, what are the mechanisms? Because I think from one point of view is that if you do the research study to figure out what are the mechanisms and causal factors and things like that, then the next step could also be beyond the research is like, now we've discovered what the causes are, and now we can set up a service-oriented project to actually try to, address or ameliorate or kind of like basically try to fix some of the impact, and having insights into the mechanisms is an important start. So I think the research is great, and as we are, like I'm in the medical school, the idea is that if we identify the disparities but also understand the mechanisms, then our next step is figure out how do we take advantage of available clinical resources to then address those mechanisms and address those impacts.
Okay, thank you. Thank you.
Any other questions?
I had a minor one about the budget. So, with the NIH, they usually want a percentage effort from the investigator, but from my understanding about how these grants would work, is it possible to have collaborators with 0% effort so that the money for the grant would go towards funding the reagents, for example, and also gift cards for the participants and things like that. So basically, I'm saying that the money might not be enough to do percentage effort if you have 3 collaborators on it. With the successful awards,
Yeah.
can you put 0% effort, for example?
You're free to not spend money.
No, but will it be rejected? It would be rejected from the
actually,
NIH.
No. I'm absolutely for more bang for the buck. And I think these have come up. I mean, it's more of a technical issue, whether or not that counts as cost sharing and things like that. I think I would not worry about that. That's easily dealt with.
Right. But I would putting an estimate of how much time you think you would spend on the project. It would sort of be kind in terms of salary. But now we know,
I've never seen in kind, but this is what you suggest for these grants.
Yeah.
Okay.
So I absolutely agree with David that just having a sense of how much time anyway that you plan on spending on it. Any other questions?
One question that was submitted before the workshop was about mentorship for the first pilot grants. In terms of the proposal needing to identify a specific mentor before submission, or if the mentorship can be arranged afterwards for funded proposal.
The proposal should have a specific mentor, an idea of who the mentor will be beforehand when they submit it. Yeah, because that goes into the whole, how is the training being affected, and accomplished, and is it a good fit, right?
Mm-hmm.
Evelyn had a question?
Yes. Hello, everyone. Thank you so much for this webinar. I love it, and I love to see all this diversity for researchers. I would like to submit a grant for the first award. So I would like to know if you have any recommendations for the bio sketch. So because I know that we have to follow certain structures. I have currently 2 articles under review. So should I also add those 2 options, or should I just keep those ones that are already published? Thank you.
If this were being submitted to the NIH as like an R01 application, they wouldn't count papers unless they're already in press. But for our purposes, that's actually helpful to include because it helps us understand where you're headed. And especially for a first award, this is really mainly about helping you develop your career. So we absolutely want that information.
Okay, thank you. And are there any restrictions for international scholars? Because I know that NSF, for instance, sometimes you cannot apply to certain funding if you are not resident or citizen.
Oh, I don't know that we haven't had to address that question. I mean, most of these grants are for full-time UCR faculty, but since postdocs can apply for these, that's a question we haven't actually had to answer. I don't have a quick answer for you.
Okay,
but we can look into that.
Thank you so much.
Any other questions? So sorry, I came back just at the end of that response. Any other questions? Okay, so just a reminder, the next proposal due date is June 5th.